Now we're just going to give a few moments to come in, and I'm so looking forward to this evening. I really am, and hope that you are too. So what I will do is, as you know, if you've been with me on these series before, I always love to start with some mindfulness, with some breath work, just to bring all of us, all of our attention together. I like to imagine that we're in a virtual space, but let's imagine that we're actually together in some lovely, I don't know, a beautiful room overlooking an amazing lake or somewhere together that we can all, collectively bring our energy together. So we let go of the day and we calm our nervous system and we bring our focus to this very important topic, which is to lengthen your life with the 9 lessons from the blue zones. And in particular, I want to look at emotional stress on the heart with our very special guest this evening. So, without further ado, let's just take a moment to really ground yourself down, maybe feel your feet on the earth, and we're going to actually focus on the heart. Why not? It is the topic of our webinar this evening. So, you can place your 2 hands on your heart, and if you're comfortable to do so, just close down the eyes for a moment. Perhaps you can feel your heart beat. Let's just make that connection in. Perhaps a sense of gratitude for the beating of your heart. Let's imagine now that we're going to breathe through the heart. We'll take 3 deep, heartfelt breaths. So when you're ready, breathing in and imagining literally the heart opening as you breathe in, and that lovely exhale as you release. So maybe cleansing and clearing the heart. Second breath, feeling the heart open. As you exhale, cleansing and clearing. And then our third and deepest heartfelt breath in through the nose. That lovely long exhale out, cleansing, clearing. Lovely. So opening up your eyes whenever you are ready. I have a lovely quote here that I'd like to start the session with, and it is, "Once your mind is calm and full of love, there is no room for hatred or fear. Others will trust you because of your open heart." And that was and is the Dalai Lama who said that. So just to go over some housekeeping before I introduce our amazing guests this evening. As always, please do keep the chats going. It's just one of the very integral parts of having a live webinar is that we have that capacity to really interact with you. Please do put any questions that you have in the box below and upvote the question. Hopefully we'll have time to direct a question directly to Robert at the end, but please do upvote the question, and that is the question that we will select. Thank you so much to everyone who has donated. We're very grateful to you. If you haven't, you still can, and thank you so much for that. It really helps us to make these events possible. So our guest tonight is Dr. Robert Kelly. He is a consultant cardiologist and lifestyle medicine physician. He's an author, he's a public speaker, and he's a health coach. He has trained and worked in cardiology all over the world, in the USA, the UK, and Europe. He has published over 50 papers in peer-reviewed journals and presented at international meetings. He is a recipient of several distinguished awards, prizes, and grants for his work on cardiology. Dr. Kelly is the lead clinical representative for Ireland at the European Lifestyle Medicine Organization, and he is a member of the American College of Lifestyle Medicine. So that's his bio. Now, I read his bio, and we can all do that, right? And it doesn't really mean very much. Well, it means a lot. So this is your full career and all your the work that you've done, Robert. I don't mean to say that. But what I mean is that, I think what's really interesting is how, to give you some kind of personal introduction to how I first came across Dr. Robert Kelly. And he was a lecturer of mine in the RCSI last year. And I have to say, it was actually one of my favorite lectures. It just literally cracked me up. I learned so much, but also the way that Robert delivers, as you'll see here this evening, he's got an amazing way to communicate really important information in a very witty and sort of very dry, brilliant sense of humor, and that's just very easy to absorb and to learn. So I always remember his lecture. So then me being me, contacted Robert and said, "Hello, how are you?" And we said, "Let's meet for a coffee," and discovered that we were neighbours. So that was really lovely. We had a great chat as well, and we've chatted back and forth. And sometimes we bump into each other in the area. Well, Robert's usually running, or I'm with the dog, or we have that lovely ability to communicate. So just to say why Robert is my hero, a personal hero of mine. And this goes back to a personal story of my own father, who, when I was 10 years of age, sat me down on his knee and he drew a picture of his heart and the two main arteries coming out of the aorta. And he got a pen and he simply just coloured in. He kind of like coloured in the one artery. And then he got the second and he coloured that halfway in. And he said, "So this is Daddy's heart at the moment," he said. And he was 39 years of age. It was 1985, and he was preparing for a triple bypass. So he went in, he had the surgery. So again, this is why cardiologists are such heroes of mine and heroines of mine, because the idea that something like that so many years ago has had such a huge impact on saving his life. So, coupled with the surgery, my dad, before even lifestyle medicine was a name, or if you like, or something that we spoke about, completely transformed his lifestyle. He gave up smoking. He really cut down on alcohol. He started going to the gym. He was a member of Pat Henry's. He was doing all of these really important things. And as a result, he is healthy and well, almost like one of the blue zones. He's walking up hills in Greece. He's 78 years of age. And, it's just a testament to both. And I think that's what it brings it together. It brings the surgery, the cardiology, coupled with lifestyle medicine. So cardiovascular diseases are the leading cause of death worldwide, globally, and they take an estimated 17.9 million lives each year, according to the World Health Organization. So, Robert, like, you truly are my hero, and I'm very grateful to you for being here this evening. So, thank you very much. So, my first question, Robert, is really, what was it that's my personal story, but what was it in your life that drove you to, first of all, become a cardiologist, and second of all, then to look at lifestyle medicine as such an important factor in the patient's journey?
Well, Fiona, thank you so much for having me and for all those really kind words that you have never actually said to me before. So I was really taken aback when there was a hero bit to the beginning of the story. So thank you so much. And it's wonderful to hear about your dad's story, because that's the reason I got into lifestyle medicine, is because I realized that while I was treating patients, I'm fully trained as a stent doctor. Patients keep coming back with chest pain because the treatment doesn't make a difference, or it doesn't make all the difference. Patients still come back where the cholesterol is high, the blood pressure is not controlled. And there's always a sense that either the patients don't understand what is or is not being given to them in terms of information, or else that the patient's needs are not really being met. And so it led me into the space which is lifestyle medicine. And then I was very surprised through a lot of different meetings and through different people I met, that the whole composite of looking after your eating habits, your exercise, your sleeping, your stress, and your whole social connection would have such a bearing in terms of improving your outcome, just like the story of your dad. My entry into cardiology is mixed with a little bit of sadness on my behalf, in that I lost my younger brother to sudden cardiac death when I was in my final year of medical school. And he died. He was the year behind me in medical school. And I actually, that was over 30 years ago. But subsequent to that, I wouldn't have seen myself doing cardiology because of that. And then looking back in hindsight, I come from a medical family. My late father is a surgeon. My mother is a retired surgeon. My sister is an eye specialist. I have one brother who works in the bank, thankfully. And so there is a very strong medical element in the family. And ironically, my eye doctor sister has recently taken to lifestyle medicine as well. But the big thing in this for me was that I think in hindsight, it probably had a bearing in my big desire to help people live longer in truth and to at least defer illness. Cardiology has evolved a lot in the last couple of decades, at least while I've been in practice, that it's not seen as a death sentence like it might have been seen as before. We can do an awful lot. The value of lifestyle medicine is we can do so much more for people. And I suppose we're going to talk about that in a few minutes.
Yeah, absolutely. So at what point, Robert, did you kind of like on your whole journey, let's say so far, when was it that you realized it was so important to start to focus on lifestyle medicine? Was it early on in your practice, or
I
when did that
suppose
become so apparent?
so. About 6 or 7 years into my career, I started to realize that when you're in private practice and you're on your own, that the pressure of a very busy job, a very busy practice, a young family would really eat into one's time. And so you'd have very little time left after, and so you get very tired in the job. And you could see that in patients, you could see that in other people you spoke to and friends, and realizing that there really had to be something more, that there was no room for all these different pillars. Exercise in particular, eating is another one. So I think that that kind of led me to explore, was there more one could do? And then I went to, as I say, I went to an American lifestyle meeting with our friend Beth Freitas, and our interaction was really quite transformative, because I convinced her that she should come to Ireland and tell the Irish people, or the two of us should tell the Irish people together about what lifestyle medicine was about, and she truly followed through on that. So I think it was from then, because I'll admit my childhood mightn't have been as, I often say to patients, I'm not a saint here. I mean, I make mistakes like everybody else. While you have seen me out running, there's loads of other days you haven't seen me out running at all either. So
That's yes,
and
yeah.
I
I can tell
still
about the time I saw you there outside the pub with the
yeah,
with the
exactly, yeah.
yeah.
Yeah,
I know.
with the glass of
Um,
water. I know you remember that, and the piece
I
of
do.
fruit.
I
Yeah,
remember
absolutely.
that. Yeah, with
Yeah,
me with all my pints. Um, no, but to get back to what I'd love to share this evening are the gnawing lessons. The blue zones become really popular again, haven't they, Robert? Because of the Netflix documentary, and they're becoming more and more sort of mainstream, and people are starting to learn about them. So for those that do know, great. But for those who don't, would you mind just briefly sort of saying what the blue zones are, and then to go through? There's 9 different sort of common lessons, let's say, from all of the different regions, and maybe go through those, and then particularly choose the ones that are pertinent to heart health. I'm sure they all are, but maybe the ones that you feel are most relevant.
sure. So the Blue Zones, as you say, have had a recent boost in popularity because a gentleman called Dan Butner, who's an American journalist, spent initially, he used to work for the National Geographic, which is a very international geographic publication. He then was a very professional exercise cyclist. He cycled from California the whole way around the world. And during his experience, somebody said to him, did you come across any interesting places in the world where people seem to be more healthy or live longer? And he thought this was very exciting. So he decided to go and find out where those places were. And so, ironically, there was a lot of scientific work already done. So those places were established. He literally put them on the map. So those areas include an island off the southern coast of Japan called Okinawa. And Okinawa is very interesting because it's in the northern part of the island, and the southern part of the island is a US Air Force base for the Pacific, where you get a complete contrast in health between the two halves of the island. The other areas is there's an island in Greece, it's called Ikaria. There's another part of the world in Sardinia, Costa Rica in the southern part of South America. There's a place called Nicoya, and then there's an area of northern of Southern California called Lindalomo,
Linda or something, is it?
Lindalomo, and then there's
Yeah.
another area which Dan Butner mentioned, Singapore. There's another area of the world which is Mauritius off the coast of Africa, also is a blue zone. So there's 6 or 7 blue zones in this world. So the characteristic finding is that the people in this part of the world all seem to reach 100+ years of age, but they're not the same, not despite the geographic locations. They vary a little bit in terms of the reasons why. And they all have different histories about their locations. And also, if you look at some of them, one of the interesting ones is if you take Sardinia, it's a very localized area of Sardinia. It's not that you all go on holidays to Sardinia and think that you're going to get some magic elixir that when you come back to Ireland, you'll live to 100. It's a very small location. It's at the side of a mountain. It's not on the beach. It's up a mountain where the people actually live and grew up. So it's quite a different situation. One of the other interesting ones is in Japan and Okinawa. There is a huge preponderance of generations of women. They are mothers, grandmothers, great-great-grandmothers. A lot of the husbands died during the First World War. The Japanese government came after the women at that stage. They didn't want them to be living in the island. A lot of them hid in caves and subsequently survived. Whereas if you look at the Icaria and the Sardinia population, the men and the women are both alive. So there are different factors. But Dan Butner has reported 9 power habits or 9 factors that he considers to be the key factors. So the first one is move naturally. That's physical activity. The second one is purpose, or ikigai is what the Japanese call that. So that's a reason to live and get out of bed every day. The third one is about lowering your stress level. The fourth one is about eating only till you're 80% full instead of eating the whole plate. So the next one that relates to that is the preference around a plant-based diet. The one that the Irish people tend to like is you're allowed to drink alcohol on this longevity plan, typically red wine, although in Japan there are other varieties of this. And then the other thing that's very natural to Irish people, which is interesting, is the huge sense of community in blue zones, the importance of putting family first, and then the whole aspect that this whole social circle or your tribe that you hang around with, the people you surround yourself with, not just your family, your friends as well, has a very significant bearing on getting an opportunity to live longer in life. So they are the 9 pillars. Now, Johnny, you asked me about how they relate to heart and which ones are my favorite, and they all relate to heart. But I suppose, as you said, I run. So I would strongly advocate that exercise is the best medicine that was ever created in the world. That has been known since the foundation of health from Greek times. And the ultimate situation is that if you take 30 minutes of moderate paced exercise, like a run or a brisk walk every single day, ideally, then you'll live longer. Your heart will do much better. Bear in mind, if you have a better, healthier heart, you'll live longer. The two of them do go together. So exercise is very important. As you get older in life, it's not just the walking. It's also important to do what's called resistance-based exercise, which includes things like push-ups or press-ups. Now, if that's a big toll for you, you can lift the shopping bags out of the car. You can buy a pair of resistance bands and try and stretch your limbs. Or I'll tell patients that they should go to the gym, meet one trainer, and have one session with the trainer to give you some guidance on the things you can do. A lot of other patients use their kids who happen to be personal trainers or into areas of sports. But again, your safety is first, because your safety is what dictates how your health ultimately goes when you get older. The other one then, obviously, that goes with exercise is your eating habit. So the Mediterranean diet, the program that Butner has, is a fantastic watch in terms of the different cooking and eating habits of different parts of the world. In terms of their emphasis, Loma Linda, which is in California, is an Adventist population. So they're very spiritual, but they also have a very strict diet, which is totally whole food, plant-based diet. And Americans love whole food, plant-based diets as the healthy option, although 95% plus of the American population do not eat that healthy diet. They eat a very largely unhealthy diet. In this part of the world, which overlaps a lot with the Sardinians and the Greeks, the Italians, and other parts of the world with the more French, Hispanic, Italian population, the Mediterranean diet serves exceptionally well as a health benefit diet, not only for longevity, but also for your heart, risk reduction in terms of preventing cancer, Alzheimer's disease. It really is the best diet there possibly is. Now, it's important to understand they're not diets. They're also ways of living. So there's exercise, and there's also the amount of food, what's in the food. So it's largely plant-based. So it's salads, it's nuts. It's also about drinking plenty of water. But then as well, it's about you're allowed a small amount of alcohol. You are encouraged to eat fish in the Mediterranean-based diet, usually once or twice a week. You are discouraged from eating too much red meat. So ideally just once a week or less. You can eat chicken. And there's a lot of different vegetable-related main courses. So the Mediterranean diet is a great diet for your health. So whether it's whole food, plant-based, if that's your kind of preference, that's fine. So the moderate alcohol, I don't need to comment on. And I suppose the big thing that I find very important in health is dealing with stress. We're going to come on to that in a minute, so I put that one to the side. But the big united factor that's come, particularly since COVID, has been the consequence of being in isolation, being cocooned for a very long period of time, or being having no sort of social connections when it comes to friends and family. And very sadly, since cocooning over COVID, an awful lot of older people are still isolating themselves and don't actually come out or don't go out in the shopping and live very much on their own. And what you may not realize when it comes to heart health is that isolation, loneliness contribute to about a 30% risk of a high risk of having a stroke or a heart attack. So, I mean, if you have a neighbor who lives on their own, it's so important, like it was during COVID, to reach out, say hello, just keep an eye on them. If you have a family friend who lives on their own, the same is true. If you have colleagues at work, it's the exact same is true. The power of social connection, the power of the tribe is incredible for health. And one of the little things I will share, because it mentions the family first idea, that you put your family first. And I know we all try to do that, and we all have different successes in that way. But one of the nice ways to link a lot of the lifestyle habits is having dinner with your family or with your friends, where you can still have a drink or two, where you try to have a healthy meal, where you talk to each other. And I suppose in the stressful ways of life, that you maybe just calm a little bit and are slow to tuck into the food, which is a little bit more mindful. So ironically, it's about bringing a lot of old traditions back, which
It
is probably the
is,
reason a
yeah.
lot of our parents get to live for so long, you know?
And combining them, I love that idea, Robert, of actually sort of, consciously choosing, okay, I don't have to isolate these habits, I can actually bring them together. But I think it's a really good point as well about people on their own, older people. Like it became really obvious during COVID, but then as everyone's got busier, it's like that can, people can forget again. So I think that's a really good reminder to us all, is just to look around us and see, is there someone there who is still as if it were, living in a lockdown, and that's just the kind of unfortunate cycle they might have got into, because of those years, So that's a really good point. We
Absolutely.
need, no man is an island, isn't that it, Robert?
That's right. Or woman, I might add, or woman.
Yeah, that's very true. Thank you. Um, okay, so we touched on stress there, but what I'd love to do is just remind everybody here to answer the polls. I have some brilliant polls here that I think are going to be really interesting. I can't wait to read them. So please do, if you haven't already, answer them now, and I'll go through them in a moment. Because what I want to do then is really start to talk about stress in particular. And this series is called Building Emotional Resilience. So I really want to talk to you, Robert, about the impact of stressful emotions on our heart, and you know what that can actually, how damaging that can be, or what we can do to make that better. Another thing I think we definitely don't want to miss is something you're very good at, and I know your coaching program tackles this, and that is, behavior change. Like, we can know these 9 lessons, we can learn them, and we can have the best intentions in the world, right? But it's implementing them, isn't that it? It's actually really finding a way to commit to making those changes in your life. So we'll touch on those two things. Um, Before we do, I'll just read these polls out. So, have you heard of the blue zone? So, 51% had and 49% hadn't. So, I'm glad we answered that and covered that for people. Are you proactive in increasing your longevity? So 58% of people are saying yes, they are, 8% say no. And there we go. There's that kind of, I'd say, the gray zone, sometimes 33%. So maybe that's where somebody might, be good. And I don't even like to say that, but sort of, have healthier lifestyle habits, and then kind of go out of that, and sort of bounce between the two, which is really common and really understandable. So, how old do you believe you will live to based on your current health and lifestyle? This is the one that I'm really interested in, to be honest. So, 13% are saying they're going to live to 70 plus. Um, 75% are saying 80 plus, and 12% are saying 90 plus, and 0%. I haven't voted. I actually have a plan here, Robert. I don't know if I told you, but it's 102 that I'm going to 102. So I'm in that zero, but I'm that 1% there. There's a tiny number there. So well, that's lovely to see, actually, though, isn't it? That 12% of you here this evening have the intention of living to 90 plus. Would you say, Robert, like that is actually important, your mindset around it, your idea that
So
you have this intention?
absolutely. I think it's really, really important that you have a very clear intention as to what you want, because if you don't, you'll just kind of you won't go anywhere. As you say, that big challenge we all have is we all say we do things and we don't do them, or we come up with an excuse, or something comes up that kind of takes the thought away, and so things don't get done. The lifestyle habits that are mentioned from the blue zones, unless you actually commit to doing them, you won't be part of the 90-year-olds or the 80-year-olds. Now, ironically, the life expectancy in the population at the moment in Ireland is somewhere around the early 80s for a man and the mid 80s for a woman. But they're not like perfect means that half the population get to that. It does vary. If you stay well, you have a better chance. Believe it or not, a lot of these illnesses you can survive through them, even with the benefits of lifestyle medicine. But again, it's you got to do the work. I love telling patients, if you want to take up exercise, I can't do the push-ups for you. You have to do it yourself. So it's the same in terms of you know what you should be doing. You mentioned it a minute ago. The biggest challenge, and this is what I coach in my coaching program, is we all know what we need to do, but we, by a very large proportion, go, sure, no, I'm fine, sure, nobody in our family gets that, sure, doesn't matter, I don't have time. And so ultimately the doing component doesn't happen.
Yeah, or the intention of next week, Monday, that
Yeah,
whole idea,
yeah,
I'll start a new year, all that
yeah,
kind of, procrastination. Yeah.
yeah.
But I do think it's important to notice or to highlight that intention is important. So even, because a lot of the work I do is visualization and hypnotherapy, etc. And the idea of, being able to visualize yourself. Like I can see
Mm.
myself into my late 90s, 100. I can see that image, and it's actually really inspiring. It can be a motivating factor
Mm.
when you feel like you don't want to go for that run or whatever it might be, to have that image in your mind. And also something you said while we were chatting, Robert, before we went live there, I think it's a nice time to bring it up. And it's the idea you were talking about how, a lot of doctors dismiss older patients. They come in maybe in their late 70s or early 80s, and there's a sense of, well, they're not really giving them that kind of care, or maybe the sort of um, treatment that you think that they really truly deserve.
Well, I had an experience recently where a patient came to see me and told me he had attended a colleague in another hospital for the last 20 years. And I said to him, well, what are you here for? He says, well, Dr. Kelly, I want to talk to you about my longevity. And I said, well, so that's fascinating. I said, what would you like to specifically talk about? Because obviously you've decided somebody else is looking after your heart. But no, 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 no. He says, I'm not here to talk to you about my heart. So what he was very interested to talk about were what could he do to improve his length of life. And a lot of it, he, like a lot of his and her generation, are very well read. So they, and like our generation, they ask their friends what they do. So they all come into different circles. It is that connection. And people of that age want to live as long and as healthy as is possible. You say 102. I have a patient I saw last week. He's 98 years of age. He turned around to me and said, Robert, I need you to be around for the next 12 years for me. So there you go. So his expectation is 110. He comes from an interesting family of a lot of 90-year-olds. And we were actually talking about this webinar. He and I was telling him I was on this. And he said to me, he said, now, Robert, a lot of Irish people don't kind of aspire to 100. Could you not kind of find a green zone that you could just get people to 90? I mean, I think a lot of us will be happy enough with kind of that stage. If we get to 90, we can dream and we can set our intentions to get to the next 10. But I think even as you say, while we might all visualize getting to 100, I think some people need to visualize getting to their mid 50s some to their 60s, some and beyond,
True.
to
Yes.
kind of
Yeah.
step them forward.
And isn't it also that it's not, it's how you actually are. It's not the fact that you're 100 or 80 or
Mm.
whatever age. It's your health really. That you could be any. I actually feel better now, and I'm 48. I feel healthier now than I did 20 years ago. So, it's really it is down to how you take care of
Mm.
yourself, and that
Well,
can.
you see, in cardiology, as I said earlier, we're very fortunate. It's evolved a lot in what we can do for patients. But people are absolutely petrified they'll have a stroke. People are petrified that they would end up with certain types of cancer, which have a very bad prognosis. And people are petrified they'd end up with Alzheimer's disease. So, you can prevent all these illnesses, completely prevent them by the behaviors you choose in your life, from other factors we haven't spoke about, not smoking, the diet you pick, the activity is huge, the stress is huge. All these factors, they all overlap. So that to give yourself the best chance is about following those.
Yeah. I think that's even worth repeating. It's so integral, isn't it, that you can actually prevent these, and it's in your,
Yeah,
your health is in your hands, really, essentially, isn't it? And just that is so
totally.
empowering. Yeah.
Mm.
Um, okay, so I'll keep going with these. Do you practice stress management tools such as meditation and mindfulness? They're just two tools, but they really tie into the whole breath work, which is a huge important tool to help us regulate. So 47% are saying yes, they do. 15% saying no, and then we're back into that area of sometimes. Okay, and I think that's really showing us something. It's highlighting that idea. People know what they should be doing, but then can fall out of the positive habits that they created. Um, do you feel the impact of both positive and negative emotions on your heart? And this is really what I'm so interested in, Robert, to ask you about. And it's the idea of how we do, like absolutely, I can feel an emotion in my heart, whether it's a positive emotion of joy, whether it's, anxiety or stress. It feels to me very much heart centered. And it seems I'm not alone. 94% of people are saying yes, they feel emotion in their heart. So I want to definitely talk about that. Do you worry about your heart health? 63% say yes, and 37% say no. Do you worry about the heart health of a loved one? And that is, I think, very common for people to worry about their partners or parents. Or so 69% are saying yes, and 31% are saying no. So with that in mind, right, the idea of worrying, it's very much connected into stress, isn't it? So can you talk us through, Robert, like what impact does, and when I say stress, I want to be clear, I'm talking about negative stress, because there is such a thing, as we know, as positive stress in terms of that
Mm.
idea of adrenaline, motivation, getting up in the morning and healthy levels of motivation and stress. But really, when we're looking at it from a chronic perspective, where it's that low level of drip, 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 like a tap that doesn't turn off, and someone is in that chronic state of stress, what does that actually do to the heart on a biological level? What's going on?
So it has a number of different effects. So it has a chemical hormonal effect. So it'll increase your cortisol, it'll increase your adrenaline, that'll increase your heart rate. It may put your blood pressure up or down. It may cause you to perspire a lot. It may give you chest pain. It might give you heart palpitations. Um, and one of the things about stress, there's a couple of things to highlight. So we mentioned the question about caring about loved ones' health. So there are situations very classically in patients, you see it in cardiology, where somebody loses a loved one. So say your mother dies suddenly and your father is left behind. And sometimes your father might develop acute chest pain or symptoms of very bad shortness of breath. And some people like that come into a hospital and they develop frank heart failure, which is entirely due to the stress caused by the loss of a loved one. Ironically, my grandmother died suddenly, and my grandfather died 6 weeks after she died. Very much of the opinion, and that's called the broken heart syndrome. And you see it, and I see it in lots of patients, nearly always in people who are husband and wife rather than the other dynamic within the family. So stress has a big relationship in that, and I suppose the emotion there is love, leaving the heart, or in some way love getting stronger and sometimes causing all those chemical effects. The other comment about chronic stress, which is really, really important, because chronic stress is epidemic in this country at the minute and probably around the world, is that chronic stress has been shown very, very clearly to predict a risk of having a heart attack, having a stroke, developing cancer, reducing your life expectancy. And the risk in that is about a 30% risk that you'll get those things unless you deal with chronic stress. And the point to highlight to everybody is that risk is totally independent of whether you smoke, whether you have high blood pressure, whether you have bad cholesterol. So those things just add to it. So chronic stress is a big focus of where I practice, because while it was particularly bad around COVID, COVID hit it very well. It was always there before, and it's persisted. And so, you know, everybody gets it, as Fiona may mentioned, in different shapes and forms. So we're going to talk about that, I think, shortly.
Yeah, absolutely, Robert. So, you know, the idea there that it basically has such a negative impact on the heart that we talk about. There's so many phrases, aren't there, you know, about the heart, you know, broken heart, half-hearted. We have so many, it just comes into language all the time. And, you know, the idea that the heart, and I know this is something that is relatively new, and you'll be the person to share more on this in terms of the heart brain and how it communicates, and this whole idea of heart coherence. Um, would you talk us through that a little bit? Because I think that helps us to understand perhaps the emotional impact of emotions on the heart.
One of the little biology lessons that you need to understand when it comes to the human body and the heart is that the heart and the brain are connected to each other. So they're connected either through a network of nerves, which regulate things like heart rate and blood pressure in particular. So that's called your autonomic nervous system. And when you're very, very stressed out, as I said, your heart rate can go up and down, and your blood pressure can go up and down. So when you're under pressure, as I said, you might feel your heart thumping, or for some matters, you might get other symptoms. So one of the things you can do, and this is very well established by a very, very famous cardiologist, he was based in Harvard, who came up with, he did a research thesis about how breathing can improve your heart rate and your blood pressure response. And he showed you could treat things like high blood pressure, you could treat heart disease and heart failure by doing that. His name is Herbert Benson, and he's not alive anymore, but Herbert Benson set up the Mind Body Medicine Institute in Harvard University Medical School in America. And he runs a course every very year. The groups still run a course talking about the influence of the mind on the rest of the body, including the influence of the mind on the heart. So there is this idea that you can improve your heart health by regulating your breathing, which impacts your stress level through your brain, and therefore you can control the signal that's going through your autonomic nervous system. So there are numbers of different technologies out there. One of it's called HeartMath, which effectively measures your heart rate variability. I actually do the same thing with patients with another piece of technology, which is a heart monitor that measures the same thing. And it's fascinating to see what happens to patients who don't sleep properly, to see how their stress response goes literally out the window. And a lot of it happens when people work really, really hard. They're totally stressed out. They don't have time at the end of the day to fit in any healthy things, and they go to bed and sleep very badly. So the same response is evident. The other group of people who are very busy, very stressed out, decide then that's the perfect time to go and exercise. So they go out and do a massive amount of running after a day's work. And guess what? They don't sleep very well either. They only fall asleep because they're so exhausted. If you drink a lot of alcohol late at evening, or if you eat your dinner late at evening, you see the same thing. So you see all those other lifestyle factors playing back on your heart rate variability. And you can see that the way you think in your head has a huge bearing on this, in the link between what your brain is telling your heart and how you are looking after your heart. And for that matter, from the stress response, how you're looking after your head.
Yeah, absolutely. I know because you know that there's six pillars, as you know, Robert, of lifestyle medicine. And I feel that yes, they're pillars, but they're almost like they're so interconnected. It's like a
Mm.
wheel almost that each
Yeah.
one has a role to play. And if one
Mm.
spoke is gone, it's going to have an impact. Um, so you may know my new book is on sleep. So a lot of what you're saying there is really pertinent and definitely matches the research I've done in terms of emotional resilience when you're not sleeping is so low that you just something that you could manage like it's something small becomes this huge thing, a huge stress that people then get very reactive about, and then that has the knock-on effect of course that their arousal system's too high to
Mm.
switch off and to go to sleep. So
And
so it's
Fiona, one of the things to add is that, like the stress risk and the increase in the risk of having a heart attack, if you sleep less than 6 hours or more than 9 hours of what your sleep pattern is, you also have a 30% increased risk of having a heart attack or a stroke. So, the sleep as a risk or as a pillar is critical. And yes, how you get to sleep and the quality of your sleep is hugely impacted by the lifestyle pillars. So it's also a huge consequence of your stress, but it's also a big contributor to your stress remaining chronic. So
exactly it's
again, I
that
see a
vicious circle.
huge amount of sleep issues. Really, really do.
Yeah,
It's
yeah, no,
extraordinary.
it's yeah, yeah. The book will fly off the shelves, Robert. Wait and see. Um,
Just as long
but
as
yeah,
you
no,
read
it's
it
in.
in the early part of the day.
Yeah, no. Do you know? Well, I won't go into it, but I've written it in a way that it doesn't create anxiety. That it's all really to help people manage and unwind. But I think it's an interesting point that you said. Often we speak about sleep not being enough. Like we say, I'm not getting enough, less than 6 hours. But the idea that more than nine is something we don't actually really say often enough, that if you're sleeping too much, it also has a detrimental effect. On particular,
A
is
lot of
that in the
it's to do
heart?
with a lot of it's to do with how old you are. So if you're
Okay.
younger, you need to sleep longer than if you're older. Uh,
Yes.
the other thing for the viewers is that if you find you're tired waking up in the morning, you're not sleeping properly. And if you find that you're waking up on a Saturday morning and you're feeling tired, then you have a problem with your sleep during the week. Now,
Yes.
obviously, if you're out late every single Friday night, you'll have a problem sleeping through a Friday night and you'll feel tired. But the comment is there that you can work out yourself. Because a lot of people fall asleep because they're exhausted. That doesn't mean you get a good quality sleep. And the sleep is there to help you recover. So it's really, really important. So
Yeah, yeah, absolutely. Well, look, Robert, I'm going to go here. We have some questions that have come in, and I'm just going to see which ones are most upvoted, if they have been. So maybe take a moment here, everyone, and read some of the questions, and then I will pick the one that is most upvoted. So, has anyone upvoted them at all? I don't know. I can't see that. You see that, Kieran? Kieran's here behind the scenes helping. Let me just have a look. Don't worry. So I can see there's one that's come in that we've already answered about teens. Yes, that doesn't apply to teens, right? The 9 hours, Robert, wouldn't apply. So there's one here that's been upvoted a little bit, so I'll ask this one. Hi, Dr. Kelly. I contracted COVID at the end of July and I was extremely sick for 3 weeks, testing positive for those 3 weeks. Then I got pleurisy after that. I was sick for another 2 weeks. I was reasonably fit prior to being sick, going to the gym 3 times a week and losing over a stone in weight. I have found it increasingly difficult to get back to exercise and my breathing is still not back to par. Have you any suggestions as to how I can get myself back to better health? I'm also going through a difficult marriage separation. I'm in my late 50s. I am on blood pressure tablets and statin. Thank you. So Deirdre, thanks for that. You've got a lot going on to say the least. What would you say, Robert, to this lovely viewer?
so I would say to you that I have multiple patients who have the exact same problems that you have. And I would probably see one or two or three every week, new patients with the same thing. This is for the rest of you the consequence of having COVID that lasts longer than 3 months, which is defined as a long COVID illness. Unfortunately, there is a huge disproportion of young, healthy, fit women who seem to get it much more than any other group of patients. Now, ironically, all the unhealthy patients are the same people who died prematurely from COVID, because people who have existing conditions like blood pressures, cholesterol, et cetera, have a 12 times higher risk of dying from COVID. But unfortunately, the very healthy people like this lady have been left with the residual symptoms that is very, very debilitating. So a lot of patients will report a great difficulty in concentrating. That's called brain fog. A lot of people will have heart palpitations when they try to do anything at all. Some are dizzy with that. Because people have difficulty concentrating, it's usually because they don't sleep very well, or sometimes they sleep for very long hours. And so the concentration is affected. And then most fit, healthy young people want to continue to be fit and healthy as they were before this happened. And that's actually the last thing that should be done, because the rest of the body doesn't like all the exercise and starting off. So, in people like this, what I have done is I've actually applied the tools of lifestyle medicine because they're very effective. So, as an example, I have tried to get people to change their diet to a Mediterranean or a whole food plant-based diet, which is largely about cutting out sugary contents in your diet, because it would appear that that helps you to sleep a bit better. The other thing I've done is got people to stop drinking coffee for a month. Because that affects your heart palpitations, I've got people to stay off alcohol by the same way. And ironically, some of those small steps will actually help you to feel better. Now, one of the things about trying to get you to change your behavior is if you feel better, it tends to give you a good positive feedback of a degree of progress. And that tends to help you move forward, because at the moment, you're very stuck, unfortunately, in a cycle that just doesn't seem to help. Now, from the pillars of stress, it's a challenge. The stress of being caught with the illness is number one. But number two, it's when you're having a very difficult marriage situation, that's also very, very stressful. So in the circumstances of trying to prioritize things that you have control of versus things you don't have control of, and letting go of some of those things, or reaching out to that tribe and other people in your family to help you out, is huge. And unfortunately, the blood pressure, but not the cholesterol, you do see that in patients with long COVID. Again, you may need to take medications, but as I say to patients, most people with long COVID, it goes away. And so there is hope there for the future. So there is hope a lot of the medications can be reviewed. But we use medications, we use the lifestyle. People like you, I'm more than delighted to see you as patients, because it's easier to offer an awful lot more to you in person. And I do fully understand. We have a COVID clinic in the hospital for long COVID patients. It became so popular early on, we couldn't meet the demand. So what we've done is, myself as a cardiologist and a number of my respiratory colleagues have tried to create a situation where more patients get seen by us, by segmenting out those who have more respiratory issues than those who have more cardiology issues. And in many cases, most people have the symptoms. There's a lot of overlap. But as I said, the positive piece of this is that most people with long COVID get better. The other factors in life, whether you have long COVID or not, unfortunately do require their own attention, as you can fully understand. And I do think that, having a physical health checkout is important. Somebody mentions there in terms of just checking there isn't anything else going on, because some of the patients with COVID and long COVID trigger autoimmune conditions that you don't realize you had. And then, unfortunately, as I said, the important thing is probably to concentrate, get a good night's sleep. Trying to make some lifestyle changes will help you. And as I said, getting professional help where you think it may be of value is definitely worthwhile looking at.
Robert, that's so helpful, honestly. I mean, for anyone here who knows anybody who has long COVID, I just think that advice is absolutely priceless and so valuable. So thank you for sharing it. And again, the optimism that comes through there, that's just something we touched on a little bit as well, about the whole area of optimists live longer. So for this lady here, Deirdre, what you're going through is so tough, and it's that chicken and egg situation, isn't it, that the stress and the worry of being ill, and then coupled with this marriage situation, it's like it's really really a tough time. But again, having that hope, having that optimism, taking it siga siga, as they say in Greek, slowly, one step at a time, I think will really help. And I do hope that information will help others as well. So thank you, Deirdre. So this question as well, I think, is a good one. Can you increase your longevity even if both your parents died relatively young, i.e., early 60s, with heart-related issues? So I think I know what you're going to say, but what are you going to say, Robert?
So the answer is yes. And the reason for that is that when you look at what causes disease or ill health, 50% of it is due to human behavior. So your habits make up 50% of the reason why you might get sick. 20% of it is what's called social determinants of health. So where some people voted on the polls that they were in the middle, some of you might just not know what's involved in a healthy diet, or some of you might know what lifestyle is, or some of you might know what certain things are related to your health. So there are aspects around what you understand. There are aspects around your education. There are aspects in parts of the world where you live, where, was at a talk last week where somebody was talking about lifestyle and eating. And she came from a part of the world that the eating issue was as much about starvation as it was about obesity. So you got to bear, the circumstances have a huge bearing. 10% of the risk relates to access to the healthcare system. So we could all probably be put in that one at the moment. And then 20% risk. So 1/5 of your risk for getting a heart problem or cancer, et cetera, is due to your family history. So you have a 70% or an 80% chance that if you tick off all the other aspects of your health, that you will absolutely reach a long life. So I think, and actually had a patient like that today who every single member of the family has had a heart problem, and she's perfectly healthy and perfectly well, and she's just making a huge assumption that she's going to get into trouble because of the family history. And I've said, well, that's not the case. So, I mean, I think you have to have this self-belief that you
Yes,
are
it's
going to get better.
empowering.
Yeah,
Robert,
no,
I think
absolutely.
it really truly is. And so many people don't actually know that, because I know in my own
Yeah.
clinical experience, I'll have clients telling me, "Oh, I'm just so worried, you see, because my parents," and it's almost like this predetermined fatalistic
But
perspective.
Fiona, I would like to make one comment about it, which is
Yeah,
if you do have a family history in heart disease, go and find out whether you have the problem first,
yes.
rather than assuming that you are the athlete or you are the vegetarian or you are the teetotaler and that you will be perfectly all right. And the athlete one is a great example. We all know athletes who dropped out. And the point about that is that if you ignore the potential risk, knowing in your family certain conditions exist, assuming that it will never happen to you, which is what an awful lot of people do, then unfortunately you are asking for the potential of significant trouble. So it's always worthwhile to check it out first, but be
Yes.
aware that where you don't have that problem, say you have a heart test like a CAT scan that rules out heart disease, and you
Mhm.
don't have that problem, well, then at least you know that at least there's even more encouragement to live a healthy life, giving you the greater opportunity to live a long and happy life.
It can go too far the other way. You're absolutely right. And I've done it
Absolutely.
myself. I
Yeah.
went and got a stress
Yeah.
test just to check because of my father's heart, and I'll keep an eye on my son as well. So absolutely, you've got to be, aware of it. But I suppose it's just knowing that it doesn't have to be that way, that there,
Mm.
and to get it checked exactly so you're not worrying, because it's
Mm.
back to the stress, isn't it? It's all that worry and stress that people put on themselves. That,
But the other thing, as you're saying, in that is the
yeah,
idea that if you exercise,
yeah.
you will live much longer, even if you have heart disease. You will respond better to treatment. There's good stuff related to women with breast cancer who live longer in the survival who exercise. There is good data that people also get a better response to treatment who exercise. And the same comes out in terms of these different diets. So, my strength in terms of being a cardiologist and a doctor is that I am totally scientifically grounded in what I'm trying to tell you. This is not coming off social media. This is coming from science and from medical science. So this is proof that these things make a difference, that these things will help to keep you healthy and will help you towards that longevity that you wish for.
Exactly. Yes. Yeah. No. It's really so valuable. So many questions coming in. I think people are just so delighted to have access to your expertise, Robert. To be honest with you,
Very
and I
kind of
don't
you.
blame them. So there's just one here I think that could be relevant for different people here this evening, and that is, what effect does anxiety medications have on heart health? For example, Seroquel, 75 milligrams a day. Would you know anything about that? And I'm sure you might.
So
I don't.
I think the big challenge around it comes back to stress a little bit. It comes back to mental health, which clearly is a very significant challenge in society. I think that the anti-anxiety medications, while many people need them to manage anxiety, I think that some of them do have side effects, one of which is they can stimulate people to eat more. And sometimes you end up having to take other measures to suppress your appetite. And sometimes you have to take medication for that, or sometimes you may have to just be more mindful to the fact of dealing with other pillars. Now, obviously, if you have an anxiety problem, it's really important to treat it because you'll make yourself very anxious in trying to think about how you're going to do the lifestyle pillars. So, I mean, there's no doubt that things in, say, in stress that's good for you is exercise is very good for you when it comes to dealing with stress. Meeting other people, as we mentioned earlier on, is really, really good for you when dealing with stress. Getting a night's sleep, not drinking alcohol to excess, all those factors can really, really help you no matter what health issue you have. So I think if you're taking those medicines, if you really want to get the best out of them, just like any other medicine, all those essentials that come from, be it the blue zone habits or the lifestyle medicine pillars, are all the same. They're all essential as part of your treatment.
Yes, exactly. It's a piece of the jigsaw. But I suppose what her
Yeah.
question was, is there any negative impact on heart health that you know of, or in
Not
particular, would you say?
directly.
Okay.
Some of them have effects that they'll trigger other symptoms like heart palpitations. They don't lead to any increase in heart disease. Some people have rhythm issues that come up with some of these medications that need to be checked out, but they don't increase the risk of having a heart attack. The problem with mental
Okay.
health is the other behaviors that sometimes befall people with mental health issues.
Yeah, exactly. It's all the other parts of it that
Mm.
are being neglected, maybe. Okay. So just to bring it all together before we finish up, Robert, like I think what I always love to do, and people will know who follow my work, is that I like to work on two levels. I like to work on the psychological level of understanding what's going on, the emotional side, but then also always the practical side of things. So if we look at the nine lessons, let's say, from the blue zones, and we've gone through them there, and they're kind of like, a lot of them are common sense, in terms of we know these things, as we've said. But what would you say on a practical level, Robert, that people can actually do to start to implement them? What is even one thing that someone can say, okay, I'm going to come off this webinar and I'm going to do this. What would it be to start to make that change? And it could be any one of those nine lessons. It's less about the behavior and more about the mindset. What would you recommend?
So I think you said it earlier on, which was set a clear intention. I mean, if your goal is that you want to live to 100, well, you might be 30 at this stage. So you've a long way to go. So you've got to make certain choices as you go through life. But you do need a goal to have a target to go for. And as Fiona said, it's really valuable to actually visualize that. So I think that you've got to make that choice. If you make the choice that you're going to be healthy, then what follows from that is the intention that you have to be healthy every day. So I try and encourage people to make healthy choices every day. So if, for example, you have choices around what you're going to have for breakfast or for lunch or for dinner, or my approach is all about teaching people habits, which is largely just about taking a small step and then just trying to build out from that. And ironically, there's some great work out there by a lady called Crum, Crumm. She's a psychologist. She's based in Stanford. And she's written a lot of really good work about how you feel emotionally, because you'll only do something if you like it. No matter what you think, you are not going to become a runner if you do not like it. And there's no point even trying to do it because you think you're going to live to 100 if you run more. The only way it's going to work is if you tie the emotion into the intention, that you do things that you like. So you pick things that you're good at already. If you already walk and you want to add running, you'll have a better chance of succeeding it than somebody who's never even learned how to walk. So I think it's very, very important to be clear, to make the choice, and then to start small and build from it. And then just to acknowledge that makes you feel good and acknowledge that getting to feel better, that exercise will help you live longer. Well, then you're going to be more successful achieving that as a consequence of continuing to exercise and building and growing from it. So that would be the most practical, simple thing to do. If you
Yes.
cannot exercise because you're an older listener here and you don't have the best pair of legs, well, then pick some other form of physical activity that you can do, which might be just a little stretching, or it might be the point of view of just a little bit of swimming or whatever is relevant to you.
Yes, the movement. Yeah,
Yeah.
absolutely. It's essential. Yeah. So thank you, Robert. That's really helpful. It really gives, I think, people so much hope and optimism, and just the idea that we have this impact on our own longevity. I think that is the main message to take away, isn't it, from today, from this evening. I just want to let everyone here know that Robert has an online coaching program. So Kieran, if you wouldn't mind just sharing Robert's website for people watching this evening, they can go and they can look at that. I think it would be so worthwhile. It's an online group coaching, isn't that correct? Um,
Mhm.
he has a new book coming out in January, so we'll all be looking forward to that. Absolutely. And I just want to say to everyone, thank you so much for being here. It really means a lot. In terms of my own work coming up, I have a self-compassion, which I think, Robert, is a huge part of it, isn't it? To be able to have compassion for ourselves, especially when, for example, our behavior isn't as we would hope it to be or we think that it should be. I think that compassion for ourselves can actually be a very motivating factor. And I know that that's something you've spoken about as well, in terms of, you know, to have the compassion for yourself, to be able to see beyond your years, if you like, to be able to see, the motivation of your grandchildren playing, to see that vision of why are you making these changes. I think that's really important to
So
always come back to
I'd
that.
share one story with you just before I finish. So I had a
Do.
patient today in the clinic whose wife has Alzheimer's disease, and he's managed to keep it from his children who now know and can see what's happening to him. And he has struggled with mental health a little bit of late dealing with this. So my lifestyle advice to him was to get his daughters to keep an eye on their mother for an hour a week so he can get out and do some physical activity, but more importantly, that he can meet his friends for lunch or meet his friends for bridge. But the message in that is the importance of self care, because in that example, if something happens to that man, and he's a patient of mine because he has a heart condition, if something happens to that man because he doesn't look after his self care, well, then that family have a huge problem because there'll be nobody there to look after his wife. His children will have a huge problem because they'll be stuck with that situation as well. And so the biggest challenge around self compassion comes from people who look after other people, mothers in general, doctors, nurses, people who work in service related industries. We are all brilliant at the jobs we do. We are so good at helping everybody else. And we are the worst people in the world for looking after ourselves. And there is a consequence, just like that man's situation, of that, what comes with it.
Yeah, yeah. Well, that's speaking, I suppose, from someone who knows, Robert. And I hope you take good care of yourself now.
Oh,
I'll
I
be,
do.
I'll
I
be
do.
watching
I'm
in the
back to that
neighborhood.
fart thing you were doing at the beginning.
Yeah, exactly. Yes.
Mm-hmm.
Yeah. Even between patients, to center yourself, because you
Absolutely.
do work so hard. And I'm really so grateful to you for the time here this evening. And I'm sure everyone is here also. So thank you so much. Lovely messages coming in. Fantastic
Yeah.
webinar. Really enjoyed it. So thank you to Kieran as well behind the scenes. It means an awful, awful lot. And we'll be back next month, and we'll announce details about that really soon. So Robert, enjoy the rest of your evening. Sleep well, everybody. Look
Yeah.
after yourselves, and thank you so much. Lots of love. See you soon. I'll see you running, Robert.
And I see you with your yoga mat, Fiona, going
Yeah,
off to
you
your
will.
yoga.
You will.
Yeah, there you go
Yeah.
now. That's it.
Thanks, Robert. Talk to you soon.
Take
Bye
care.
bye.
Also, see you. Bye.
Bye.